Hello, everyone, and welcome back to the EchoPod Season 2 Breaking Taboos Stories of Resilience. This season, we will focus on the current opiate epidemic in San Joaquin County. First, we'd like to take this time to introduce ourselves, and we're the Health Equity Team. And I'm Quincel.
I'm Angie.
I'm Jazzy.
And I'm Hannah.
And for the ECHO team, we're equity in COVID and health outcomes, and our mission is...
Our mission is our approach centers on recognizing the importance of shaping healthcare based on human experiences. So this involves a fundamental shift in power dynamics within healthcare services, requiring the development of trust between communities and service providers. So Little Manila Rising serves as a bridge to cultivate this trust, fostering relationships that enhance health resources, improve literacy, combat disinformation, and influence inclusive health policies. Acting as a convener, we form partnerships with organizations sharing our values, educating them on community needs. Through workshops and advocacy, we empower our community to self-advocate and shape the future of healthcare in South Stockton.
We believe that healthcare is a human right that can only be achieved through creating genuine equity throughout all of our healthcare systems. The health systems we work to shape must not only eliminate the existing barriers based on language, economic status, and individual identity, but it must also inform and empower each person to give the people they serve agency over the services that they receive. And next, I'll pass it to the DOT program.
Yeah, hi everyone. I'm Jazz Marie Latour. Feel free to call me Jazzy, and I'm the Asthma Mitigation Director for the DAWN program. DAWN stands for Decreasing Asthma Within Neighborhoods, and it was created with the intention to help mitigate asthma in South Stockton in the intersections of environmental justice and health equity, focusing on a racial justice lens. We understand that the complexities behind asthma are more than just a health need, and there's so much more that goes into it. So we hope to empower our South Stockton community to expand their existing knowledge on asthma and to engage them in social justice and advocacy to live longer and healthier lives overall. And I'll pass it over to Hannah.
So our mental health program is called Healing Puso. Puso is also translated to heart in Tagalog, and it's also an acronym. So the acronym is Pilipinex Uplifting Self and Others. So Healing Puso envisions a world in which the systemic barriers to mental health for our community are dismantled, and our people are given the knowledge and agency to normalize and prioritize their mental health and well-being. We aim to facilitate individual and collective healing through racial, historical, institutional, and intergenerational trauma. And our mission is to take on a human-centered approach, guided and informed by the community, to change systems that don't incorporate our traditions and values. We must inform those systems by telling our stories, like what we're doing today, informing them of our culturally rooted practices, and changing the power structures, making sure that we're taking in our stories and wisdom to help guide different policies. To accomplish this, Little Manila Rising as a whole provides holistic healing practices that align with our community's culture and values, and we specifically provide individual and group support through healing circles and one-on-one social emotional support. We do therapy referrals to Community Medical Center, and we provide healing arts workshops, wellness workshops at Delta College, all again aim to improve the mental health and well-being of our community. On the systemic level, we develop restorative and healing-centered policies and lead community-driven advocacy that transforms our mental health care system. So that's a little bit about our mental health work.
Awesome. And before we get into the rest of our episodes, we'd like to first introduce why we're doing this work and what is an opiate and some statistics in San Joaquin County. So first, what is an opiate? Opiates are a class of drugs that derive from or mimic natural substances found in the opium poppy plant. Opiates work in the brain to produce a variety of effects such as pain relief. And as a class of substances, they act as opiate receptors to produce morphine-like effects. So some examples of opiates are heroin, morphine, codeine, oxycodone, hydrocodone, and fentanyl. So what makes opiate medicines effective for treating pain can also make them dangerous. And at lower dosages, opiates may make you feel sleepy, but higher doses can slow your breathing and heart rate, which can oftentimes lead to death.
And some statistics in California first. As of 2021 and 2022, there's been 2,006 deaths, 2,006 emergency visits, 2,006 hospitalizations, and 2008 prescriptions. Those last two were as of 2022. And then in San Joaquin County, as of 2021, 48 people have died from fentanyl overdoses. Fentanyl overdose death rates in 2021 was 20 times higher than in 2018.
And these are not the most accurate data since it's been for the past year and a half. So as we've heard, there have been a rise in deaths, emergency visits, hospitalizations, and also it's underreported because oftentimes we don't capture all the data from as accurate as possible because we don't know on a daily basis how many people truly die from opiate overdoses, but those were the statistics from 2020, 21 and 22. Yeah. And I'll pass it over to them to explain why we're doing this work.
So LMR got into this work to help to increase individual and community understanding of opioids and opioid use, stimulants and stimulant use, and or polysubstance use in the BIPOC communities that we live in South Stockton, and prioritizing harm reduction and public health solutions that focus on positive messaging around preventing substance use disorder. We also want to reduce community and individual stigma of people who use drugs and to promote care and treatment services and treatment plans.
So one of the things that we do is we try to give referrals to family members and folks impacted by opioid use and stimulant use. So part of our work is to help improve the referral system with Aegis Treatment Center, for example, or Community Medical Center, who are leading the work. One of the specific treatment services that we try to link folks to is medicated assisted treatment. In other words, MAT. We have a lot of acronyms. Other services are counseling and therapy services. So everything that we do is completely free. And I also just wanted to uplift that even though we're talking about statistics, these are real life people, right? When we're talking about statistics in the community, they're disproportionately affecting Black and Brown communities in South Stockton, for example, right? So I really wanted to uplift. The reason why we're doing this work is because we want to center the stories and experiences of people, which you'll be hearing. I'm going to go ahead and pass it over to Angie to really talk about the call to action.
Yeah, so thank you guys so much for tuning in to Breaking Taboos, Stories of Resilience, as we navigate the complexities of the opioid epidemic and work towards destigmatizing seeking help for substance use. And our call to action this episode is educate yourself. It's important to stay informed about this epidemic. Knowledge is power, and by understanding the issue, you can become an advocate for change.
Thank you.
Thank you.
Bye.
Bye.